and convergence is normal. Okay, we're going to do the outer ear. Our outer ears are central to the head. They look normal, skin tone, and it looks good. Okay, go ahead and check inside your ear. You just go ahead and check your. Do you feel any pain with this?
No.
Okay, no pain on the pinna or tragus. Do you feel anything with this?
No.
Okay, no pain on the pinna or tragus. I'm going to check inside your ear. Okay, ear canal looks pink, minimal cerumen, and your eardrum looks pearly gray. Okay, same thing on this side. Eardrum looks pearly gray, and your ear canal looks pink with minimal cerumen.
Thank you.
You're welcome. Okay, now we're going to go ahead and do CN8, which is cranial nerve 8, which is the whisper test, the Weber test, and the Ren test. Okay.
2.
Okay, very good. And
8.
okay, go ahead and we'll do the Weber test. Okay, you hear that in both ears?
Mm-hmm.
Okay, do the Ren test. Now, do you hear that more in your ear canal or behind your ear?
Ear canal.
Okay, thank you. In your ear canal or behind your ear?
Ear canal.
Okay, thank you. All right, so the Ren test is positive to air, the Weber test is positive, and the whisper test is positive. And those are for CN8. Okay, we're going to do the nose. The nose looks symmetrical upon palpation, upon inspection rather, my mistake. Okay, I'm going to check the nasal mucosa. And we're checking for the septum, the turbinates, and the to see if there's any polyps. Okay. Okay, the septum doesn't look deviated. The nasal mucosa looks clear, no polyps, and the turbinates look clear, no polyps. Okay, same on this side. The nasal mucosa looks clear and pink. The turbinates, no polyps. The nasal mucosa, no polyps. And the septum does not look deviated. Let me have you hold one side of your nose for me, please, and breathe in. And do the same thing with the other side for me, please. Okay, the nasal passages are patent. Okay. We're going to go ahead and check mouth and throat, lips, and we'll start with the lips and membranes. Okay, I'm going to have you open up and say ah for me, please. And say ah for me again. Okay, and stick out your tongue, say ah. Okay, let me check the heart, lift your tongue up for me. Okay, great. And that takes care of our cranial nerves 9, 10, and 12. Her buccal mucosa is pink. Palates, hard and soft palates. The hard palate looks a little rougher than the smooth soft palate. The only thing I didn't check yet is the gag reflex, but the tongue looks rough on the surface and smooth on the bottom. The soft palate and the uvula both rise at the same time. I'll do the gag reflex. Okay, let me just have you if you say ah. Okay, gag reflex is good. And no contractions on the tongue and no fasciculations. Just let me have you move your tongue around me for me real quick. Okay, that's fine. Thank you. Okay, so we're looking at the neck. The skin tone is even and consistent. I'll go ahead and palpate the trachea first. Okay, the trachea is in alignment. And we're going to go ahead and do the thyroid gland. And swallow for me. Okay, the thyroid gland is in place as well. Okay, we're going to start with the lymph nodes. We're going to start with the preauricular, postauricular, occipital. We're going to work our way down to the submandibular, submental, posterior cervical I'll do first. Then I'll do the anterior cervical, And I will do the supraclavicular. I don't feel any swelling, which is good. Okay, so I'm going to go ahead and do cranial nerve 11, which is the carotid artery. So I'm going to feel that right here. And use the bell of the stethoscope. And can you swallow for me, please? Okay, no buoy. And carotid artery. And hold your breath for me. No buoy. Okay, so what I'm going to have you do now is range of motion. If you could put your head down towards your chest and put your head all the way back. And we have you put your head up straight again. Move to your left side. Move to your right side. And then let me have you go ahead and turn to your left side. Turn to your right side. Okay, turn against my hand, please. And turn against my hand again. Okay, that takes care. She has good strength against resistance. And that takes care of cranial nerve 11 and good range of motion as well. Okay, we're going to do lungs and thorax now. Judging from what I'm looking at, her breath is quiet and unlabored, and her respiratory rate looks good. Her skin is warm to touch, and I don't see her using any accessory muscles in breathing. So we're going to go ahead and palpate the chest wall. Feel any pain here? Any tenderness?
No.
Okay. Any tenderness?
No.
Any tenderness?
No.
Any tenderness?
No.
Okay. All right. And we'll go to the back. Any tenderness?
No.
Here?
No.
Okay.
No.
Okay. No tenderness noted. We're going to go ahead and do chest expansion. So just breathing as you normally would. Okay. Chest expansion on the anterior is good. And chest expansion on the posterior. Okay, is good as well. Okay, so we're going to go ahead and do crepitus. Let me get the headphone. Okay. And let me have you say 99.
99.
99.
99.
99.
99.
99.
99.
99.
99.
99.
99.
Okay, that takes care of phlebitis in the front. We'll do it from the back. 99.
99.
99.
99.
99.
99.
99.
99.
99.
99.
And 99.
99.
Okay, thank you. Okay, so we'll go ahead and we'll percuss. Posterior. Okay, percussion sounds normal. We'll also take. Breathing out normal. And in and out. In and out. In and out. In and out. Okay. Now I have to breathe in and out. In and out. In and out. In and out. Out. And in and out. Okay, thank you. Okay, lung fields sound normal in all fields. Okay, looking at the interior chest, the skin tone is even and consistent for areas of the heart. I will palpate. Any pain?
No.
Okay, no pain.
No, sir.
Any pain?
No, sir.
Any pain?
No.
Any pain? Okay, I'm going to try to get the point maximum impulse. Okay, point at maximal impulse is in place. Okay, I'm going to listen to her heart with the diaphragm and the bell. Aortic, Herb's point, tricuspid, and mitral. Okay, same thing, aortic, pulmonic, Herb's point, tricuspid, and mitral. Okay, I'm going to lift up a little bit and listen to the apical pulse for 1 minute. Okay. Her rhythm is normal and her rate is 75 beats per minute. No extra heart sounds or murmurs. Okay, if I can have you lay down, we'll go ahead and we'll do your stomach. Okay, upon inspection, her stomach looks, skin looks, tone is even and consistent. Round contour, even, hair distributed evenly. Go ahead and do auscultation first. Okay, positive vowel sounds in all 4 quadrants. Go ahead and percuss. Anything? Any pain?
No.
Okay, no pain or tenderness noted. Palpate. Okay, palpation is normal. It's just a mix of dull and tympanitic sounds. Okay, if I can have you sit up for me, please. Okay, and if you can face this way, please. We'll go ahead and do upper extremities. Upon inspection, the skin tone is even and consistent. And no signs of edema. Skin is warm to touch. Okay, we can go ahead and look at your nails. Nails are smooth and clean. And capillary refill within 3 seconds. Okay, we'll go ahead and we'll do radial pulses. Let me turn around this way. Okay, radial pulses are +3 bilaterally. We'll do light and sharp sensation. How do you close your eyes for me, please? Light or sharp?
Sharp.
Light or sharp?
Light.
Light or sharp?
Sharp.
And light or sharp?
Light.
Okay, able to distinguish between light and sharp sensation. We'll go ahead and we'll do, look at the elbows. Upon inspection, there's no signs of edema or no lesions. What I'm going to do is a strength test. I'll have you put your elbows up for me, please. And put them down. Okay, and push against me. All right, elbows up and push against me. Okay, range of motion is good, and she maintained flexion against resistance bilaterally. And so let me just go ahead and have you put your thumbs to your fingers like this. Okay, great, and then just lay both hands back and forth like this. Okay, upper extremity coordination is good. We're going to go ahead and go to the lower extremities. Skin is good, no signs of edema, no lesions. Nails are good. Let's check the capillary refill. Capillary refill within 3 seconds. Okay, let's go ahead and check your pedal pulses. And we'll check your tibial pulses. Okay, pedal pulses and tibial pulses are +3 bilaterally. Let me have you close your eyes. And am I lifting your big toe up or down?
Up.
And am I lifting your big toe up or down?
Down.
Okay, let me have you put your fingers out because I'm going to go ahead and do the same thing with your hands. Am I lifting your finger up or down?
Up.
And am I lifting your thumb up or down?
Down.
Okay, thank you. All right, able to distinguish positioning? Okay, so let me just go ahead and have you put your feet up again for me. And just let me flex them up, flex them down, point your toes inwards, point your toes outwards, and then rotate both feet. Okay, range of motion is good. And go ahead and push up against my feet and push against my feet. Okay. All right. Range of motion and strength is good, grade 5. And I'm just going to do reflexes. And reflexes are normal. We're going to go to the back. Skin tone is even and consistent. Shape is vertical, normal. Normal curvature, normal symmetry. Muscle development is good. I'm going to go ahead and inspect and palpate the spine. The spine looks like it's straight, no deformities. So I'm going to go ahead and palpate. Okay. You feel anything?
No.
Okay, no pain or tenderness upon palpation. So what I'm going to have you do is stand up for me, please. And bend forward a little bit for me. And stand up straight. And flex back. Okay, stand up straight for me again. Just lean down towards your left side. And lean down towards your right side. Back up. And twist towards your left side. And twist towards your right side. Okay, range of motion is good. And I'm going to go ahead and do CVA tenderness. Let me have you turn this way for me. Any pain at all?
No.
Okay, no pain or tenderness upon CVA inspection. Okay, I'll have you, oh, you know what, as a matter of fact, let me just have you walk back and forth for me, please. Okay, and walk back the other way. And come back towards me again. Turn this way, do one shallow knee bend. And both knees. Okay. All right. That's it. That concludes our head to toe assessment. Thank you very much.
Thank you.